What's interesting is that over the last month, there have been very small increases in the number of people hospitalized.
Despite smaller numbers than we once saw, COVID is still around in the Granite State.
We're averaging less than one person per day dying from COVID-19.
In the month of July, we saw an average of 5 people hospitalized a day from COVID. Currently, we're at 10 to 15.
Certainly, numbers are still low. I would not characterize this as a new surge.
COVID cases are not reported like they used to be during the pandemic, but since December of 2022, the state has been able to keep track of rising COVID levels by testing wastewater at 14 different facilities.
Within the wastewater, that is an indicator of not only COVID, but other diseases.
Fred McNeil is the chief engineer of Manchester's Environmental Protection Division. He says in partnership with UNH and the Department of Health and Human Services, they entered a formal sampling program.
We sample our wastewater twice a week, and the state picks it up, and they use that more of an indicator on the current status of COVID and the pandemic.
Bring it to the lab and test to get some idea about levels of virus that are being found in wastewater.
Dr. Chen says the focus is shifting away from just COVID, though, and entering the fall, or as he calls it, respiratory virus season. People should be aware in order to prevent illness. And some of those options that going into the fall are an updated COVID vaccine that's supposed to be out in just a couple of months, and also an updated influenza vaccine that's out right now. There's also an RSV vaccine for people 60 years or older, and also a brand new RSV monoclonal antibody for newborns and infants. And Dr. Chan says to talk to your healthcare providers to see which option is best for you. We're live here in Manchester. Troy Lynch, WMUR News 9.